Hello and welcome to this webinar series on the topic of potty training. My name is Casey Edwards and I'm here representing the SATB2 Gene Foundation. This whole webinar series has been made possible by a grant from the Child Neurology Foundation. Joining me today I have Dr. Amanda Thompson, who received her doctorate degree in physical therapy from the University of North Texas Health Science Center back in 2013. Amanda has a particular passion for pediatric and pelvic floor health, which she combines in her clinic for pediatric incontinence and constipation. Without further ado, we'll get started in this 5-part webinar series. Thank you so much for joining us.
Thank you. My name is Amanda Thompson. I am a physical therapist at Fit-N-Wise in Decatur, Texas. Just a little bit backstory, I started doing some women's health and pediatrics when I first graduated, and I really have a passion for both. So why not combine them both to be talking about incontinence and constipation for little kids all the way up until adulthood, because we all have issues struggling from early on. So today we're going to talk a little bit about early on stuff, and then we'll kind of push the details on the how-to later. I'll try to make it short and simple and make a lot of this accessible to everyone. And then you can always email me for further questions. Let me share my screen. Okay, so we'll get started, and it takes a minute. There we go. Okay, so I will be pretty quick on this one, hopefully. There's a lot of myths out there for potty training. The biggest thing is that my kid is too old to potty train. Ideally, yes, kids are potty trained before they're in kindergarten, but unless there's something wrong with their actual bowel and bladder nerves, for example, if they have spina bifida, that would cause difficulty with potty training, but it's definitely still doable. But most people can be potty trained at any age. It just might take a little bit longer. It may take more effort on both parties, but we'll try to narrow down what works best for your kiddo. Another myth of potty training is that she or he has blank syndrome. So my child has whatever diagnosis, so they cannot be potty trained. Complete myth. They will be able to train when they're ready. So a lot of parents, especially if you're in any mom groups of typically developing children, this applies for them as well. Some kids will potty train when they're ready, and it's almost like they hit a light switch and they are potty trained, but not for every kid, and especially kids that have a little bit of a struggle coming up with developmental milestones, receptive, or any kind of communication barriers. That's going to cause a more difficult potty training, but it's definitely doable. Prerequisites for potty training. How do we know they're ready? How do you know they're ready? So some examples for prerequisites for potty training is that they're staying dry for about 2 hours at a time. So a lot of times, if you go back to early childhood when kids are in daycares or you're changing diapers every 2 hours as little children, for a typically developing child, one of the biggest reasons why you would want to start thinking about potty training is they're staying dry for more than 2 hours. If they are not staying dry for more than 2 hours, and for example, they're an older child, a school-age child, 10 or older, it's still okay that they are not staying dry and they are still able to potty train. Another prerequisite says they're having regular bowel movements, which bowel movements is a complete, not a different topic. We are going to touch on bowel movements, but it is important that they are having regular bowel movements. If the child is constipated for any way, shape, or form, it will directly impact their ability to stay continent. If they have bowel incontinence, so they are having bowel movements in a diaper, and they have no ability to know whether they're having a bowel movement, for example, after they go to the bathroom, if they're pulling at their diaper, or bowel movement, for example, if they're pulling at their diaper or kind of just uncomfortable or somehow signaling to you that they had a bowel movement. If they're not doing that, again, it's helpful, but it's not mandatory. Another big prerequisite that is helpful, but not 100%, is that they are able to follow simple commands, a one-step command. So any one-step command could be helpful in the process. If they're not signing or communicating with you, then there are ways that we can figure out, especially for specific children, finding ways to help them follow simple directions and or being able to find their specific route that we'll be able to take, which we'll talk about in a minute. I just kind of touched on demonstrating discomfort with dirty diapers. So they have a bowel movement or they have a really full diaper and they're kind of pulling on their diaper like they're uncomfortable. It doesn't matter what age they're at. Obviously, a prerequisite for potty training for a typically developing child is asking to use the toilet or wearing underwear. But usually by the time they come to me, they're past that point and they're of school age or older. So that's typically not a prerequisite that's in my wheelhouse, but it's definitely helpful. And helping pull on and off their pants. So if you are working with an OT and working on dressing, this is one of the biggest things I have them work on with the OT. OT might be working on fine motor skills, but if they are not working on helping them dress themselves, then it will be difficult. It's different if they are physically unable to, depending on their diagnosis, be able to pull on and off their pants. I don't like button pants, so I like pull on and off pants. Spandex are great. And we'll talk about different pants and underwears in the next lecture, in lecture 2. Typical approaches. So there's 100 methods out there. There's a million books out there. So I just jotted some down that are super, super, super common. There's a 3-day potty training. There's oh crap potty training. There's books out there for a million different reasons, but there's nothing out there that I have found that is specific for kids with special needs. So I wouldn't go by any of these. You could take these with a grain of salt, especially if you've done it with another child that you have, but basically it doesn't work for your kids. That's why you're coming here. Potty train is teachable. Teachable. It is very, what am I going to say? Teachable. It is not a suggestive behavior. It is a following instructions, giving the parent or caregiver giving good instructions. It's not a suggestive behavior. So just because they're watching mom and dad do it doesn't necessarily mean they're going to follow through. We're already past that point. Good instructions, teaching procedures. So every child is different on how they learn. So finding the way that they learn best and finding their motivation and incentives are going to be key, which is kind of where we're going to go at today. Teaching is got to be sequenced, it has to be planned, and then it has to be executed. If it's not executed consistently, then you can't expect the child to be consistent either. So you want to start where the child is at regarding the skill level. So if we're still working on simple commands, following one-step commands, we can talk through how you would make one step as your guide for a few weeks to help that child make that one-step command. And then you're already setting yourself up for a good behavior change. And the instructions must be motivational. You have to have incentives for the child and the parent, and then error correction feedback, which we'll go through. Oh, here's my key to stop. So I'm going to go through here. I'm going to unshare this, maybe. Stop share. So I'm going to go through a little bit more on constipation and how that would directly affect the pelvic floor. So a little bit of anatomy will be helpful to understand where everything is going to happen. The pelvic floor muscles are the muscles that support underneath our pelvis. They support all the organs above. They support our spine, and I call them the 3 S's. They're supportive, they are sphincteric, so the muscles on the outside have control, and they stabilize, 3 S's. The biggest thing is, how do we teach them to have control of those sphincters? Males and females have the same muscles. The origination is the same. They're just shaped a little bit differently. We have, or we should have, complete control of our external sphincters, the outside muscles, unless there's a damage, spinal cord injury, spina bifida, something that there's actually something wrong. So why is my child not potty trained? There can be many factors, but we're going to go through the most common factors today. Constipation. The exits to go out for males have 2 and females have 3. Okay, males have the urethra, or the exit out through the penis, and then the rectum, which is you're going to have bowel movements. Okay, if you cannot have control of it, then you're not going to be continent. Women have 3. The muscles are the same. So if you have a bowel problem, you're going to have a bladder problem, and vice versa. So bowels are super important. The biggest thing is going to be dietary factors that are going to cause or worsen constipation and incontinence, and this also includes bedwetting. So diet for bowel dysfunction. Diet for bowel dysfunction, you want to make sure you have a good amount of, and I can actually email these to you so you can pop them up, but a good amount of soluble fiber and insoluble fibers. And depending on what your child's oral motor control is, you might have to modify some of these tactics that are going to be for typically developing children and even adults. So moms and dads, if you're struggling with any of this, this is going to be key for you too. So soluble fiber holds water and it helps soften the stool. Insoluble fiber bulks our bowel and keeps it moving through the digestive tract. If we have too much of one or the other, it's going to cause constipation. If our muscles are too tight, we will have constipation. If we are an anxious child or parent, or we're in an anxious environment, we're going to have a lot of contraction in our pelvic floor, and we're not going to be able to relax our pelvic floor. So we're going to talk about that. So decreasing oils will help help with the bowel movement. So if you have a lot of oil in your diet, it will cause some more constipation. Making sure that you have the appropriate amount of fluid intake will help bowel and bladder. So fluid intake is different for everyone. The guidelines from the American Medical Association used to be 6 to 8 8-ounce glasses of water for an adult, but that's not the guidelines anymore. It's actually half of your body weight in ounces. So if you have someone that weighs 100 pounds and someone that weighs 200 pounds, you obviously need different amounts of fluid to stay hydrated. So it's the same with children. So children need less fluid than adults, but we're going to go through why in a minute. Let's see. Fiber, the fiber that I have on here is going to be for an adult, but it's going to be modified. So I'll throw some regulars in there. So hot liquids will help with constipation. So if your child likes warm milk, if they like teas, especially older children, if they're dealing with a lot of constipation, vitamin C helps loosen stools. And then having a higher fiber diet in the mornings for breakfast. So your oatmeals, your breakfast cereals, anything that's going to have a little bit more fiber in the morning. Fruits and vegetables are going to be our key. The hard part is getting our kids to eat fruits and vegetables. So hopefully we'll be able to give you some recipes on how to trick them into getting fruits and vegetables in their diet. Let's see. I have some examples for that. So making sure that they're passing gas normally too. So men actually produce 60% more gas than females, which is, I'm pretty sure everybody can figure that out, not the hard way. Okay, let's go through bladder irritants, which I forgot my papers, so you can edit that part out. So bladder irritants are going to be things that irritate your bladder or make you feel like you need to pee more frequently than you actually do. So the most common one I see in my child population is milk. Milk is a huge bladder irritant, especially for nighttime. So if they're getting milk at night, then they are probably going to have bedwetting issues. The other one are, some of them are not appropriate for most everyone, but that we're going to be the population. But chocolate is a bladder irritant. Spicy foods are bladder irritants. Any kind of milk products, so milk and milk products. So you have your cereals. If you have cereal at night, just a glass of milk, ice cream sandwiches, those are all going to be irritating to the bladder and make that bladder really stimulated. Other thing is the most common and the most irritating to your bladder is actually a dehydrated bladder. So we just talked about the normals for having helping with bowel movements, but if you're not staying hydrated, if the child's not staying hydrated, they're going to have bowel and bladder issues, because a dehydrated bladder will make your bladder spasm and be more irritated throughout the day. Another big one is vitamin C is good for bowel movements, but too much vitamin C in juices and sugar in juices, so your apple juices and any orange juices, anything citrusy is going to be irritating to the bladder. The vitamin C is actually going to be irritating for the bladder. So watering down the fluid is going to be helpful. So if your child won't drink any water, because I struggle with that too with my 5-year-old, he will not drink water no matter what I put it in. So I put the whole cup is like 3/4 water and like juice. So trying to trick them into some of those things. The other thing is if your child can get enough oral motor control, or working with your speech therapist for oral motor control, drinking out of a straw, they're going to get more fluid in at one time. So we got some bowel dietary changes and making sure they're not constipated. What is constipated? They are not having straining with bowel movements, and they're having a bowel movement 1 to 2 times a day is ideal. As we get older, so if you have a child that's in their 20s or 30s and they're not moving around as much, then every other day is okay as long as they're not straining. Bladder irritants are going to be irritating to the bladder, and they're going to make you feel like you need to pee, and it's going to have more challenging effects with your continence training if you're always giving irritants. There is a book out there, I can't remember what it's called, but it's the whole point of the book is to provide salty, sweet, as many bladder irritants as possible to make that child pee, so that you can quickly get the child to figure out that they need to pee. Unfortunately, that doesn't work for everyone. So if you've tried that and failed, you're not the only one. So we're going to take that into small pieces, and you can use some sweets as motivation or reward, but I wouldn't do it all the time. And so the other thing is, if you're going to start from ground zero and just trial something, what I would start with is eliminating bladder irritants, making sure they're not constipated, and then put them on a voiding schedule. So let's say they can pee, but they don't realize they're peeing. So some people will do no diapers, walk around. Ideally in the summer is good, so you can be outside, so you don't have to clean up the mess. But putting them on a schedule, so you should be trying to sit on the toilet every hour to hour and a half at first. Some kids will do good if you do a potty right next to your potty. Every time you go potty, the child goes potty. And some children will do good standing or sitting is a big factor I get. It's a lot easier to sit first because we can learn to relax our muscles a little bit better. Sitting, boys and girls. And then we can figure out a schedule. So if the scheduled hour, hour and a half, and they aren't peeing, and you're eliminating all the bladder irritants, and you're drinking enough water, and constipation is not an issue, Then on the next one, what we're going to talk about next time is how do I train my child that has limited communication? How do I train my child that's also maybe in a daycare or in school? And what are the steps I need to take as the caregiver to make sure that my child is at least potty trained during the day, and then the nighttime will work itself out. If there are issues that are specific for you, then we can kind of add that towards the end. And then my email is always open. So there's a lot of opportunities that we can do together to help come up with a schedule specific for you. And next time we'll do more details.
We hope you enjoyed part 1 of this webinar series on the topic of potty training our children with special needs. Amanda will be back for part 2, and we're going to take a closer look at getting started with potty training, and also Amanda will be answering some questions from our families.